My name is Tercia Soares Sharpe. I work at Inova Loudoun Hospital, Northern Virginia. First time I heard about ELNEC was 5 years ago. I had to Google to learn more. And I was so excited that I decided to go to an education program. The first one they were offering was at the VA Medical Center in San Francisco. So I flew to the West Coast. Came back so excited that I had to become a trainer. So I flew back to the West Coast and became a trainer in Glendale. And ELNEC just changed my life. It changed my practice. It changed my life because if you want to touch someone's life, you need to allow yourself to be touched by what you believe. And that's what happened to me. It's just wonderful to have the opportunity to help patients to redimension their lives with the time frame that they have. And ELNEC teaches you the tools so you can approach them. It's wonderful. ELNEC actually, it's for anybody with any educational background. I finished my bachelor's degree when I was 21, and 18 years later, I did a Master of Arts in Religion. I had no idea how I was going to implement that in my practice, but guess what? Today, when I offer the ELNEC Day in my hospital, I teach cultural and spiritual aspects. So all the anthropology and all the religions that I learned, I'm using now. So it's exciting because actually ELNEC helped me to find the purpose, my mission in my profession. And this is priceless. It's so wonderful also to see nursing students that are about to embrace a new profession, just to fall in love with the profession, just because they realize that they can touch lives. And that's what's rewarding. It's not difficult to implement all that you learn in an ELNEC program when you come back to your hospital. You just have to have the fire in your heart and take one day at a time, and little by little, you earn the trust of your colleagues. And then you just implement things. I implemented the committee, end of life committee, and then the policy for comfort care in end of life with the white wreath and the music and the comfort card. And then the education day, which I offer every year in the fall. We are going to offer our 4th program now. And we give also continuous education approved by the state of Virginia. And then the apple of my eyes, that is the memorial service. I just love it. It's a time for closure and a time for reflection. And I even presented a poster on how to make a memorial service in an ELNEC National Convention a few years ago. I've done 8 memorial services. I do every spring and fall. And it's just wonderful. This moment when you see how those families are progressing the grieving. So sometimes when cure is not an option, healing is always an option. If you have the fire in your heart and the willingness to connect to people, come, do an ELNEC program. It will be so beneficial for you and even more for those around you. ELNEC.